Hi, this is Rick Miller from Health Communication Mastery. I'm back here again with Dr. Laura Quinton. Hey Laura.
Hello, hi there.
Laura is a GP at 25 Harley Street and she has recently completed Health Communication Mastery Module 1, haven't you?
I have indeed.
So for the purposes of this interview, we're just going to talk through what Laura thought of Health Communication Mastery and just get a little bit more about her background and wrap up with some final thoughts as well. So, Laura, just for the audience's knowledge, tell us a little bit about yourself, in your practice and what you do and where you're from.
I'm Laura Quinton, I'm a GP and I have also got an interest in nutrition. So I'm actually qualified as a nutritional therapist as well as a GP.
Wow, that's quite unique.
It's a bit unusual. But I've been a GP for 20 years now, seeing patients. But I came to the conclusion that a lot of long-term conditions needed a bit more than traditional medicine. So learning about diet, nutrition, gut health has given me a lot more skills.
Great. Music's in my ears actually, because as a dietitian. Laura, do you think communication skills are important to doctors?
Oh wow, absolutely.
Right.
Yeah, completely. I mean, when I started off at medical school, that was sort of back in 1985, we didn't really get much in the way of teaching, but now medical students do get a lot of training in communication skills. And I actually teach doctors to become GPs as well, so we do work communication skills into the curriculum. But interestingly, it's very different from the skills that I learned on Health Communications Mastery, because when we're focusing on training doctors up to be GPs, it's really about fast communication skills and getting information out of the patient and getting information to the patient within the 10-minute consultation package. So these new skills that I've learned, they really make me think more about how you're portraying yourself, how you're coming across, which I didn't really think about before, so it's really challenged the way I sort of teach communication skills as well, so it's great.
Fantastic. So Laura, tell us, honestly, what did you think of Health Communication Mastery?
Well, I thought it was good. I thought it was a really good thing to do. I mean, what I liked about it is that you can dip in and out. There's so many different videos. I think you've got about 30 videos.
Yes, that's right.
Loads. And so you can dip in and out and choose the bits that are relevant to you. What I really liked is the section on telecommunications.
Great.
Because again, as a doctor, we don't get training in telecommunications, and these days more and more GPs are being asked to do consultations on Skype.
Agreed.
And all the doctors I know hate being in front of the camera. Being included. It's the sort of thing I would just avoid. But doing the course, it sort of made me realise that they're just another set of skills, like anything else.
Of course.
I mean, at the moment, I'm no way good at sort of camera skills, but it gave me the confidence to actually come and talk to you on camera today, because there's no way I would have done this before. I'm sort of not a camera person. So
that's amazing.
Thank you very much.
Oh, not at all. It's so amazing to get that sort of feedback. And so it's really helped you in a practical way.
Really practical and also simple, and it gives you that confidence in stages, so that you think, well, it's something I can do. If you're a person that hates presentations or doing camera work, try it and just take one of the skills. This is what you say in part of it. Take one of the skills and use it. Like, look at the camera, talk to your audience. Just start off simple, and I think it's really, really useful.
Amazing. So Laura, I'm going to ask you a funny question actually. Have you got any examples of where you've experienced as a GP, where communication has gone a bit wrong, or something you can share with people who are watching?
Well, something I could share.
Okay, cool.
Actually, funnily enough, I do remember, and it wasn't until I did the course and something cropped up on the course, and it made me think, if you're concerned about your image, it really starts when you're getting dressed in the morning. I also, even though I'm a doctor, I'm a real person, and I go and see doctors myself sometimes. And there was one time I went to see a gynecologist, and she had the most beautiful but statement necklace on.
Wow.
And it was only after I did the course I realised that I'd spent a lot of the time looking at this necklace, and I really remember that I still remember that necklace.
Yeah.
And I realised that it really distracted from what I wanted to get across to her as a patient.
Oh wow.
And so that made me think about, I know we're sort of taught as doctors to dress professionally, but it made me think about how you can distract somebody by what you're wearing and what you look like.
Sure.
So presentation is important.
Yeah, subtle but important thing. And
just leave the statement necklace, for when you're out socially or something.
Exactly. Yeah. So it's hard sometimes. I suppose you want to have your individual style, but then you've got to think about how that affects your patient. At the end of the day.
Oh, exactly. My daughter once went to see a dermatologist who had these jazzy spat shoes. And that's all I can remember is the shoe. And even she says, "Oh yeah, it was the guy with the shoes."
And you remembered nothing of the consultation. Wow, that's exactly. It's a great example.
Yeah.
So finally, Laura, that's been some amazing feedback on Health Communication Mastery Module 1. Overall, would you recommend it to anybody else?
Absolutely, I would recommend it. Even for the doctors that I train, I would say if you're looking to do presentation or you want to get involved and do some audio-visual work, go and have a look at the course. I've also been a student myself when I was at the College of Naturopathic Medicine, and we don't get any communication skills training there.
Wow.
So I'd say for people coming off as nutritional therapists or even as dietitians coming off the training, go and do the course and actually realise that even if you're a shy, bookish person, that you can still develop some skills that you might have been too frightened about before.
Perfect. Yeah. That's amazing. Thank you so much. And if anybody who's listening, wants to find out more about you and get in contact maybe for a consultation and see these skills in action, how can they do it? Tell them.
Well, I'm at 25 Harley Street, where we work in central London. You can look at my Instagram at Dr. Q's Views, or my website, which is drqswellness.co.uk. So check it out. Check out my blog. That's it.
Amazing. Thank you so much, Laura.
Thank you.
It's been amazing.
It's been really nice talking. Thank you.